Craughwell.
Thank you very much, Lascoir. Look, Minister, you're welcome to the House. This is my first time to meet you in this House, and congratulations on your elevation. Minister, recently on an RTE programme, I heard you interviewed, and you came across as a person who's not prepared to take any old answer. You came across as an assertive, committed minister. And, you know, one of the problems of the position you hold is when things go wrong, you're held accountable and fired, while the people who made things go wrong continue on in their posts. Now, my colleagues have mentioned the 19.1 million euros. We need clarity on that. Where did that 19.1 million euros go? Was it put into the scoliosis system? And if it was, can we have documentation to make that stand up? Because I think it's extremely important that parents and children, but particularly the parents, the ones who are looking after the developing child, that they have some assurance that monies that are gotten by ministers to carry out a specific task, that those monies are spent on that task and only that task. We cannot have people second-guessing what the minister may or may not have thought at the time. The minister gets money, and you know better than any of us how difficult it is to fight for your corner at Cabinet and to get money. So we cannot have people second-guessing what you do. In the area of scoliosis, I'm mindful of what happened with CF and how we were able to isolate CF within, I think it's St. Vincent's Hospital. So people suffering from CF are always guaranteed a bed if they need one in a safe and sterile environment where they're not going to be subjected to infection from other parts of the hospital. I think in the case of scoliosis, we need to go back to the drawing board, maybe, a little, and look at things. First and foremost, we should have a triage system. When a parent gets notice that their child has scoliosis, the first thing that would happen is discussion amongst the relations and friends about, oh my God, the child is going to have surgery. And I think it has been pointed out more than once that not every case of scoliosis requires surgery. But imagine waiting for a year to see the consultant, and in 10 or 15 minutes the consultant says, oh look, the child doesn't need surgery, we can deal with it through A, B, C or D, and out the door with you, and you're devastated. You don't know what to do. You've been planning and you've been set up for this thing, oh my God, my child is going to have surgery, and suddenly your child doesn't need surgery, and you go out the door wondering, are they just fobbing me off here? Are they just trying to shorten the queues? Are they really, when I look at my child has a problem, and these people give me 15 minutes of their time and I'm out the door and I don't know where I stand. So we need a little transparency at the very beginning when diagnosis is made. Parents need to be made aware of the fact that the child may or may not need surgery, and that following MRI scans, CT scans or whatever is involved, that a clearer picture will emerge. And in the case of a child that does not need surgery, then they're put into a different stream. So they're not in the same queue as those who need radical altering surgery. And they know from the earliest point possible that the child is in a position that the child can be dealt with without invasive surgery. And they should be delighted to get that news. Absolutely delighted. Now, my colleague Senator McDougall, when he put this together, he put it together on the basis that ministers cannot be always accountable for what happens within the health service executive. And this is protection for the minister. It's protection for the families, it's protection for the children, because there's a statutory basis on which scoliosis treatment will be given. When I look at the numbers today, first and foremost, we have a serious problem in trying to understand why the numbers are increasing. Why was there an increase of 10% between 24 and 25? What's going on there? Is it that we have become better at diagnosing the situation? Is it that I suppose the clinicians have become better? But when you look at 233 children on a waiting list, And some of them, 43 of them, are on a waiting list for over 6 months. And when I look a little further, I find that 15 more are on a waiting list for more than 2 years. I wonder, when I look at those 43 and the 15, how many will, at the end of the process, be told, actually, your child doesn't need surgery, they need a specific brace, or they need some sort of physiotherapy to bring them over the line. And this is where time is lost, this is where anger grows, this is where doubts and distrust arises. If I've been waiting a long time and at the end of the wait, I'm told, actually, you don't need surgery, you're fine, we can do it with a brace, we can do it with physiotherapy, we can do it in some other way. And I think the earlier we get to that stage, Minister, I think the earlier we get to that stage, the better. And once we know that a child does not need surgery, we can then put them into a stream where they're dealt with by a different set of clinicians, a different set of medics. And we can free up the surgeon's time to do what surgeons do, and that is to carry out the surgery on the children in question. It's extremely difficult to expect surgeons to interview and speak to 10, 20, 30 parents in a particular session in an afternoon, and we've all been in those clinics at some stage or other where there are massive numbers, all of them at high anxiety levels, all of them waiting to see a surgeon, and at the end of the day, time constraints limit the amount of time the surgeon has to explain the situation. And for surgeons, it's a question of dealing with facts, which sometimes are not easy to take. So from that point of view, I am really concerned that what we do here is we make an accountable system. We have a system where everything in it is transparent, where the accountability and the reporting back to you, Minister, and those who follow you, is vitally important. So as you're kept aware of the situation, if we can do it with CF, we can do it with scoliosis. Scoliosis is a horrible, painful disease, or condition, should I say, for those who suffer from it. And you will know yourself that when any sort of illness enters a family, it finds its way down through the entire family. The person suffering from the illness becomes the focus of the family, and other kids, you'll have heard it yourself, other kids feel resentful at the end of the day that mum and dad were tied up with the child that has the condition while I was left to my own devices type thing. Again, the prospect of using the purchase fund to send children to wherever we can get the surgery done quickest, again, that brings other problems. It brings problems of maybe a working parent having to take leave of absence to go with the child to the United Kingdom or the United States. And again, we've got to provide provision there to make sure that the family does not fall into some sort of economic problems. So from that point of view, I think it's hugely important. Minister, I really appreciate the fact that I understand this bill is not going to be contested, that you're not going to object to it, and that's really important because it shows that you have similar concerns to the concerns our group has. And when Senator McDougall drew up this bill, it was about the children, it was about the families. It was never going to be a political thing. I abhor the notion that ministers be kicked all over the place purely because something under their area of responsibility didn't work. We should never get to that stage. We should hold the people accountable on the coalface, the people that are wrong in this. And I heard you speak about the need to have weekend cover in hospitals and things like that. You clearly have some very strong views as to how to fix things within the health service. And I really applaud you for that. I think it's wonderful that you've taken that stand. What I would like to see now is that on the scoliosis issue, we use this bill to ring-fence scoliosis as a condition that can be looked after under the bill. I think Senator McDougall, I missed the opening part of his debate, but I think he will probably have adverted to the fact that scoliosis is not just children. Children grow into adults, and adults develop problems as they grow older. So those who are diagnosed with scoliosis will have to live with it all their lives, and there will be constant visits back to clinicians, there will be constant issues that have to be dealt with. And any of these chronic conditions, it means that there is a commitment from the state to look after you from day one. And the problem is, I remember at one time when I was president of a union, one of the officials in the union says to me, we've only to put up with you for a year and somebody else will take over. There might be a certain amount of that within our public service. Next election, he or she will be gone and somebody else will have to deal with it. And that's why it's important that the legislation is there to tie down this, regardless of who is the minister in the position at the end of the day. So I could go around in circles all afternoon. I'm not going to do that. I thank you for your time. I do believe you are a seriously committed minister, and I do believe that you have your eye on the targets that you want to meet. And any way we can support that, we would like to do that. But I really do want to see this bill pass into law. Thank you.